Hi everyone, myself Dr. G.S. Jammu. So we are starting a series of frequently asked questions after the bariatric surgery. So in my first presentation, the topic we are going to cover is dumping and the low sugar levels after the bariatric surgery. So why does it happen and how to manage it? So starting with my presentation, for those who don't know what is dumping syndrome, well, this is some bad feeling which occurs in response to certain type of bad foods when we eat or when we eat very fast. So what is the feeling like? A feeling is a patient in an attack of dumping may feel sweating, palpitations, increased heart rate, and sensation of going to loo, and even a sensation of fainting sometimes. Usually the attack would start within 10 to 15 minutes of taking a bad food. What is bad food? I'll come to that. And it subsides within 30 minutes. So if no help is available to you nearby, the best way is to sit down or lie down or whatever space you can have immediately. The attack would usually subside within 30 minutes. So why that dumping occurs? So you can see in this picture why dumping occurs. So there are two compartments I'm showing. In the first compartment, which is blue plus green droplets, it's a part of intestine, and the other is the extra intestinal part in the body itself. So what is happening? You see the green part, the green drops is the sugar. Sugar is considered to be a bad food or simple carbohydrate. So when we are taking some bad food like junk stuff or simple carbohydrates or simple sugars, the osmotic pressure inside the intestine that will increase. So as a result, the body wants to neutralize that increased osmotic pressure. As a result, the fluid from the extra intestinal space, that is extra luminal space, will try to rush into the intestine so as to neutralize the osmotic pressure. As a result, there is a rapid influx of fluid from the extra luminal, extra intestinal space into the intestine, and this fluid rush will cause sudden distension of the intestine, which will give you sensation of epigastric fullness and feeling of a sensation of sweating, increased heart rate, and even sensation of going to loo. So this is the cause, and the best way, as the picture indicates, is to avoid the bad foods, that is simple carbs or the sugar itself will help you to resolve this. Or if at all you have to take this food, you have to take it in very minute small quantities and eat it very, very slowly. So these are some of the faces, emojis I can show you. How does attack of dumping will occur? The patient has pallor, is sweating, is looking confused, and sometimes loss of consciousness, some blurred vision. All these are the symptoms of attack of dumping. And how to tackle with the hypoglycemia or the low sugar levels or the dumping? For that, you have to take food very frequently. That means you can't skip any meals. Rather, we advise after bariatric surgery you start eating every 2 to 2.5 hours something. And what should your food consist of? It should be a mixed combination of carbs, proteins, fats. So protein proportion should be in good amount. Normally, when patient has not undergone any bariatric surgery, we say that carbohydrates may be 50% and proteins may be 30 to 40% and rest may be fats. But after surgery, we tell you to reduce the carbohydrates and increase the protein part, because protein is one thing which will stay in your stomach, in your tummy for a longer period of time as compared to the carbohydrates, because carbohydrates are passed into the intestine sooner than the protein stuff. So you have to eat frequent meals. You can't skip your breakfast, because breakfast is when you are get up from sleep, that you already have starvation of 8 to 9 hours, and if you skip your breakfast meals, then you will start having craving later on in the day, and you will rush and eat anything what your hands can grab on, may it be the simple sugars, candies, carbs, which can cause you dumping, or the low sugar levels. So why does sugar will cause low sugar levels? I'll come to that point as well. But let me tell you how to manage this dumping or hypoglycemia. So your diet should consist of a good amount of protein. The diet should have good amount of fiber as well. Try eating complex carbohydrates. Complex carbohydrates are like oats, quinoa, wheat flour sort of thing, pumpkin seeds. So you can have those things ready when you don't have access to the food. So for example, for a professional person who is traveling or who doesn't have access to food at that particular time, so you should have something not ready like almonds, walnuts, pumpkin seeds, so that you can munch it and you can skip that at a time of skipped meal. Then avoid foods with a high sugar content, that is high glycemic index. They may be sugars, they may be grapes, they may be mangoes, they may be fruit juices. Here you have to avoid all that stuff. Try to cut down your alcohol as well, and you should do mindful eating. What is mindful eating? You should know what to eat, when to eat, how to eat, and your nutritionist, your bariatric surgeon can be the best persons to guide you for that. If at all dumping is not going up, please note down whatever you are eating and bring that to us or your concerned doctors and tell them we can pinpoint that these are the foods which can cause you dumping sometimes. So start making a note of whatever you are eating. Try planning making your meal. That means your food should consist of good amount of proteins, less of carbs. If at all carbs are eating, they should be complex in nature. So make this sort of diary, and always don't skip your meal and try to have your meals always. If at all the dumping is not settling down with all these changes in the dietary system, like eating slowly and having proper diet, eating less sugars, if again it's not going, then there is medical management for that. What is medical management? There are few prescribed medicines which are not over the counter available medicines, and they have to be taken under medical care. To name few, they are like carbos, they are octreotides, they are liraglutides, diazoxide, and there are some calcium channel blockers as well. But only your family doctor or your physician or bariatric surgeons, they are the best people to guide you how to take and for how long to take all these medicines. Again, I should let you know what are the good foods when you don't have access to the proper meals. You should keep these foods ready in your office or your car. These are the almonds, walnuts, roasted chickpeas, lotus seeds, roasted soya, mixed seeds like sunflower, pumpkin, flax, and chia seeds as well. Now, I just wanted to explain to you why do the sugar levels fall after even eating sugars or candies in a patient of bariatric surgery. So, well, friends, there are two reasons for that. In any case of bariatric surgery, either we have reduced the size of your stomach, that is, the stomach is responsible for the reservoir of food. It is that organ of the body where food gets stored, and it is called cause of hunger in all of us, and the food is broken down in the stomach with the action of the acid, and then it is passed into the intestines for the absorption. Now in bariatric surgery, we have cut down the size of the stomach. And the second thing, in procedures like mini gastric bypass, Roux-en-Y gastric bypass, or any intestinal bypass procedures, we have bypassed some part of your small intestine, which is the proximal part, maybe duodenum, jejunum, and some proximal part of the ileum. So what is happening? What is causing dumping? Dumping is a rapid transit of food from the proximal part of your intestine into the distal. That is, food from the stomach is rapidly going into the intestines, and that to the distal intestines, because we have bypassed some part of the proximal intestines. So food may be in the raw form when it is hitting the distal intestines. The distal intestines are not used to that receiving that type of food, because normally the food undergoes some chemical changes while it is traveling through some parts of the intestine. By the time it reaches distal intestine, it is already chemically changed. It is a transformed food, and the intestine is already receptive to receive that kind of stuff. But in intestinal bypasses, the food is still in the raw form. When it reaches the intestine, distal intestine, and the body or the intestine reacts, it reacts in the form of some something raw has entered in the lumen of the intestines, and the patient will have some tachycardia, lack of feeling, even pain, epigastric fullness, vomiting, or sensation of going to loo. So the best way is you should recognize the foods which are bad, which are producing this, which in the raw form can give a reaction to the intestines, and intestines in their own will produce reaction in the body in the form of dumping syndrome, which I have already explained. So try eating food very slowly, chew it properly, and then swallow it inside, and try to avoid foods which are bad for you. These are the simple carbohydrates like sugary stuff, fruit juices, foods which are high in sugar content like mangoes, grapes, or so many other things. So stop taking all those stuff. Thank you so much.